ensure that the most up-to-date information is available about the approved COVID-19 vaccines in Canada. For example, we have produced a series of webinars to equip them to answer questions and concerns. It is essential that Canadians get the answers they might be seeking to make the right decisions for themselves about their healthcare choices. As always, Health Canada, the Public Health Agency of Canada, the provinces and territories, and the manufacturers continue to closely monitor the safety of COVID-19 vaccines. We know that some serious events will occur after immunization. However, this does not mean that the vaccine has caused the event, and these events may be caused by pre-existing conditions. This is why we ask that all events reported so that they can be reviewed to determine if the vaccine played a role in causing the event. We will respond to any safety issues right away and will inform Canadians about any risks that arise. The bottom line is that vaccines are the best way to protect ourselves from COVID-19. However, as we wait our turn to be vaccinated, it is critical to remember that the most effective thing we can all do to protect ourselves and to limit the spread of the virus is to follow local public health guidance on gatherings, physical distancing, wearing masks, and other measures. Maintenant en français.
Now in French. Good day, everyone, and thank you for participating in this technical briefing on COVID-19 vaccine rollout in Canada. With me are Major General Danny Fortin from the Public Health Agency of Canada and Dr. Tom Wong, Chief Medical Officer of Public Health for Indigenous Services Canada. Earlier this week, Canada reached 700,000 cases of COVID-19 and 18,000 deaths. Every new update on COVID-19 numbers symbolize real stories and grief. The recent announcement of the slowdown in Pfizer vaccine deliveries in Canada was a setback. However, we are still on track to receive the 4 million Pfizer vaccines that we were anticipating by the end of this first quarter, and we will be able to vaccinate all Canadians who wish to be vaccinated by the end of September 2021. We have published a slide to members of the media on this technical briefing. The slide gives an overview of cumulative plans for vaccinating Canadians based on supply. In the first row, the figures are only based on the 2 vaccines that have been approved by Health Canada. Those are the Pfizer-BioNTech and Moderna vaccines. In the second row, the figures take into consideration vaccines that Canada has purchased but that have not been approved by Health Canada. We will be in a position to vaccinate Canadians against COVID-19 by the end of September 2021. It is important to note that these figures are estimates that may change based on a number of factors, including clinical trials, providers, and supply chains. As more and more Canadians get vaccinated, it is important for each and every Canadian to understand the importance and the safety of the COVID-19 vaccinations. To that end, we are cooperating with partners across Canada to set up and send out resources to inform people about the approved COVID-19 vaccines. We have set up webinars to train health professionals on information regarding these vaccines so that the Canadian population can obtain answers to questions they may have about their health decisions. The Public Health Agency of Canada, provinces and territories, and other partners, including providers, are working together And we know that certain serious events will take place after vaccination, but that does not mean that the vaccine will have been the cause of those events. Those events could have been caused by pre-existing conditions. That is why it is important to report all health events after vaccination so they can be studied to determine the cause. We will keep Canadians abreast of the vaccination situation. The bottom line is getting the vaccine is the best way to protect against COVID-19. And while we're all waiting to be vaccinated, the best thing that we can do to protect ourselves and others and to stop the spread of the virus is to follow public health guidelines in your region regarding gatherings, mask wearing, and other measures. Now I will give the floor to Major General Denis Fortin and then Dr. Tom Wong. Thank you.
Well, thank you very much, Dr. New, and good afternoon, everyone. To date, we have distributed over 1.1 million vaccines to provinces and territories. Last week, Pfizer indicated that their shipments to Canada would be reduced until mid-February due to efforts to expand the manufacturing capacity at the plant in Belgium. On Tuesday this week, Pfizer informed us to further fluctuations in our short-term allocations, including the deferral of all doses expected for next week. Now, to update on where we are now, this week we delivered 190,125 doses of Pfizer-BioNTech to the provinces, representing 82% of what we had originally anticipated. Several provinces were impacted with reductions, some disproportionately, based on shipping decisions made by the manufacturer. We have made a commitment to provinces most impacted that their allocations will be rebalanced as soon as supply is available. To be clear, there'll be no supply of vaccines next week, the week of January 25th. Pfizer informed us this morning that we can expect around 79,000 doses for the first week of February. So despite this bump on the road, Pfizer continues to assure us that they're on track to meet the total allocation of 4 million Canada by the end of March. To that end, we expect a rapid scale-up of deliveries in the upcoming weeks following this current supply disruption. Now, the next Moderna shipment is scheduled for the first week of February as well, with an estimated 230,400 doses of their vaccine. Despite the impact of the deferral of Pfizer-BioNTech vaccines, manufacturers continue to tell us that they're on track to provide the total of 6 million doses by the end of March of both products. Now, Canadians expect us to look beyond the immediate challenge, and we're working closely with all partners at all levels to support the planning and immunization capacity building for the ramp up that will start in April. We expect that at least 20 million doses of vaccines will be available in the April to June timeframe. So last week, we provided the provinces and territories with planning allocation forecasts for this timeframe, including high, low, and medium range supply vaccine estimates. It's important to note that the mid and high end of these estimates include vaccines that are currently not approved by Health Canada, but for planning purposes, we're starting to build on that. The estimates were provided to facilitate the planning at all levels and to ensure immunization capacity in provinces and territories align as much as possible with potential vaccine availability. So there are not confirmed allocations, and we'll continue to work to confirm numbers and further advance the planning. So our work to enable provincial and territorial counterparts continues to be done proactively and transparently. This is a cooperative effort and touches on everything from vaccine availability, ancillary supplies and cold chain equipment to healthcare practitioner considerations. We're working tirelessly to ensure that we can deliver approved vaccines across Canada as soon as they become available. Alors maintenant en français, bonjour.
Now in French. Good day. To date, Canada has distributed a total of over 1.1 million vaccines to the provinces and territories. Last week, Pfizer indicated that because of what is happening in their production plant in Europe, their delivery of vaccines to Canada will be decreased by 50% until mid-February. This past Tuesday, Pfizer informed us that there would be new fluctuations in short-term deliveries. So to give you an update of the current situation, this week we delivered 125 doses of the Pfizer-BioNTech vaccine to the provinces, which is 80% of what we anticipated. Many provinces were affected by this reduction, some disproportionately because of decisions made by the manufacturer. However, we are committed to the hardest hit provinces to rebalance their provisions as soon as we have the vaccines. To be clear, there will be no Pfizer deliveries for next week, the week of January 25th. However, Pfizer assures us that in the first week of February, we will receive 79,000 doses. Pfizer continues to assure us that they are on track to deliver us the anticipated 4 million doses by the end of March. To this end, we are planning to ramp up deliveries once the vaccines are received. There will be a Moderna delivery in the first week of February of 230,400 doses. So both manufacturers, Pfizer and Moderna, continue to assure us that they are on track to deliver us their combined total of 6 million doses. We are actively working together with various partners at all levels to plan our capacity to administer vaccines. At least 20 million doses of both of the two vaccines will be available by the second quarter. We are working together with the provinces and territories to plan for upcoming quarters. We have based our plan on high, medium, and low ranges. And it is important to note that the medium and high ranges take into account vaccines that have not yet been approved by Health Canada. We are working to ensure that provinces and territories' capacity to vaccinate is aligned as much as possible. Our efforts help provincial and territorial counterparts to remain proactive, effective, and transparent. We are cooperating in this large-scale project in rolling out this important equipment. We are working tirelessly to ensure that we will be able to administer vaccines to Canadians as quickly as possible. Thank you very much, and I'll now pass it over to Dr. Wong. Thank you, Major General Fortin. Good day. First, I would like to acknowledge that I am on the unceded territory of the Algonquin people. Significant progress continues to be made on federal, provincial, territorial, and Indigenous engagement. I am pleased to see the results of this unprecedented co-planning with Indigenous partners. And I expect to see this progress continue to be made countrywide.
We are starting to see vaccine uptake in various First Nations, Inuit, and Métis communities across the country. Over 160 communities have begun vaccination clinics. In Montreal, efforts are underway to population in response to ongoing outbreaks, which is disproportionately affecting the urban Indigenous community. Coordination efforts can be seen in Ontario, where the province is working with Orange and First Nations partners to travel to 31 remote First Nations communities in Northern Ontario to help administer the Moderna vaccine. Throughout these challenging times, we are here to keep working with First Nations, Inuit, and Métis partners to protect, inform, and support communities across the country. We must continue our collaboration with communities to ensure that they have what they need to mitigate risks for further transmission of COVID-19. As vaccines continue to roll out in First Nations, Inuit, and Métis communities across Canada. Miigwech, Nakumik, Marcy, merci, and thank you. Over to moderator.
Thank you, Dr. Wong. We will now open the telephone line to questions. We will be taking questions in both official languages. We ask that you limit yourself to one question and one follow-up. Veuillez vous nommer et nous dire quel média vous représentez. Nous vous demanderons de vous limiter à une question et seulement une question de suivi. Et vous pouvez poser vos questions dans l'une des deux langues officielles. Alors, nous commençons la période de questions. Opérateur.
We will now be beginning the question period. Operator, over to you.
Star 1 at this time if you have a question. Merci. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. Our first question, Mariette Walsh, The Globe and Mail. Votre ligne est ouverte. Please go ahead.
Good afternoon. Thanks for taking our questions. Dr. New or Major General Fortin, can you please clarify which vaccines that have not yet been approved are being counted in this timeline that you've given us that shows the potential for 23 million people to be vaccinated in the second quarter? What additional vaccines are being counted in that estimate? Is it Johnson & Johnson or AstraZeneca? What is it?
Danny, do you want to go ahead?
Yes, thank you, Marika. That's those are the vaccines that Canada has agreements with, part of the portfolio of vaccines. So they include AstraZeneca, Johnson & Johnson, Novavax, and so on and so forth. Again, those are planning data. It would be, it's prudent planning on our part to factor those in and look at the different scenarios. The last thing we want to do is put jurisdictions in a place where we have additional doses coming and we hadn't factored that in early to our planning in terms of getting the right equipment in place and lining up the right health workforce. So it's the family of vaccines that Canada intends on buying.
Okay, thank you. I understand that. I guess what I was trying to clarify is, I guess from what I take from what you're saying, that all of the other yet to be approved vaccines are counted into that 23 million. Can you just clarify if that's the case? And also, can you clarify, just I'm trying to do the math on the numbers that you gave us earlier, but it looks like more than a 50% cut over 4 weeks. Can you please clarify that as well?
Okay, so to your first question, yes, it's the high level, the high watermark of all vaccines should they become approved and available over time. So it's what the figures you see is an aggregate over that period of time. Devil's in the detail, and we have various options and scenarios, where we can slice the different numbers and see, determine the so what of that. So that will allow us to do the detailed planning with provinces. As to your second question, can you repeat that?
Yeah, the second question was, it looks like it's more than a 50% cut. Can you please clarify more than a 50% cut over those 4 weeks? Thank you.
Yeah, so we don't know what the last week looks like. What we know is that we had a 82% cut last week, and that's because our shipment was nearly ready to go. And therefore, the cut to our shipment was minimal. On the aggregate, it's pretty severe to some of the provinces, and we'll work to rectify that the minute we have the next shipment. 0 this week, 79,000 following week. Don't know what the fourth week looks like. So I guess we'll wait and see and confirm what those numbers look like. But Pfizer's determined to provide as many doses as possible, as early as possible, as they retool the production line.
Thank you, Major General Fortin. I'd like to remind all our speakers to put their microphone on mute when they're not answering a question. On that, we will move to the next question. Opérateur, over to you.
Thank you. Merci. Our next question. La prochaine question, Émilie Bergeron.
Next question from Émilie Bergeron from QMI. Over to you. Good day. I have a question for Major General Fortin. The 79,000 doses for the first week of February, will they be distributed in the same way to provinces and territories?
La distribution pro rata.
The pro rata distribution remains our basic principle. We will work to rebalance deliveries for provinces that were hit hardest because of this week. So things should straighten out rather quickly. We will be working on a pro rata basis based on what had been agreed upon with Pfizer.
Merci. Question suivante.
Thank you. Follow-up question? Yes. If I remember, it was before the disruption. That there were much higher delivery rates, which have now been reduced to 79,000 doses delivered per week for February. Do you see the rhythm picking back up again, and if so, when?
Écoutez, effectivement,
Yes, it is a very serious cut compared to what we had previously anticipated to be delivered. We might expect an increase as early as next week, but we're not 100% certain. I am sharing the information with you that we have today, which is that we will receive 79,000 doses during the first week of February. We are expecting production to ramp up based on what Pfizer has told us. We do not yet know what we will be receiving for the second week of February and so on. The situation is fluid, but the concrete information we have is 79,000 doses for the first week of February, which we will be distributing as fairly as possible with provinces and territories.
Merci beaucoup, Major.
Thank you very much, Major General Fortin. We will now move on to the next question.
Merci. Thank you. Our next question, la prochaine question, Ryan Tumulty, National Post. À vous la parole. Please go ahead.
Yeah, I'm just following up on Marika's question. You mentioned that your dose that your estimate that includes all of the vaccines we have deliveries for includes ones like Novax and Sanofi and I assume Medicago. None of those vaccines have actually started to even seek Health Canada approval. They're not even in the rolling review process. I wonder why include them now when we know so little about whether or not they'll even work or get through that regulatory process.
It's Dr. New. Maybe I can start off. I think the graph or the infographic that we've distributed to all of you folks in the media, I think is intended to show you that we really have the capacity, or at least we will have enough vaccines in Canada to be able to offer vaccination to all Canadians by the end of September 2021, even just with the 2 approved vaccines. I think being very conservative, obviously we've seen that there's been a bit of a disruption in terms of the supply from the Pfizer vaccine, but that should be getting, other maybe unforeseen circumstances should arise. Know that in total, we do have purchase agreements with a total of 7 vaccine manufacturers. You're right. not all of them. I think there's 2 of them, as you well know, that have rolling submissions into Health Canada at the present time, and others haven't gotten to that point yet. But at least it's good to know that we have it in hand, that we have those advanced purchase agreements, and should we ever need to exercise those purchase agreements based on, obviously, who knows what's going to happen 1, 2, 3, 4, 5 months from now, it's good to have that sort of as they say, in our back pocket. But obviously we're working with the here and now, and certainly the information that Major General Fortin has shown you shows that you're right. We're in a bit of a tough spot right now, but I think Pfizer has indicated to us at the present time that they're still on track to meet their commitment for the 4 million doses by the end of the first quarter. So I'm not sure, Major General Fortin, do you have anything to add?
Well, I would simply add that I think you would be surprised if our team was not working on a number of assumptions to include potential vaccine candidates that might become available. So we're considering all those different variables in our planning with our partners in other federal departments, and more importantly in the provinces and in Indigenous Services Canada. And then we'll see how it goes, how those and when those vaccine candidates become approved and available, and what the scheme will be in terms of distribution over time.
Thank you. Follow up?
Yeah, I guess with the reduction that Pfizer is offering this week and next, but then promising to ramp up, and with what they've delivered so far and what Moderna has delivered so far, it seems like in the 7 weeks between middle of February there, when the Pfizer vaccines ramp up again, and the end of March, these companies will have millions of doses that they're to deliver if they're to stay on schedule. I'm wondering if you're telegraphing that to the provinces to get them ready for a big surge, possibly with numbers well above, in terms of weekly doses, what we've seen at any point so far.
Well, it ties in directly to your previous question. We're in constant conversation with our partners in provinces and territories and look at the different scenarios and what if. Can we reposition assets? Can we ensure that we have all the right lessons identified and shared across the board? But we do expect to see those numbers increase. That's what Pfizer is telling us. And if you do simple math, you see that we might see a significant increase on a weekly basis starting mid-February. And I can only work with what we currently have with Pfizer in terms of their intent to increase those numbers significantly to meet their intent to produce or to provide 4 million doses by end March. So time will tell as to what that looks like over time as they retool their production line to significantly increase their production capacity.
Thank you, Major General Fortin. Operator, next question.
Thank you. Merci. La prochaine question, Mélanie.
Next question from Mélanie Marquis from La Presse. Hello, my question is for Major General Fortin. I missed the beginning of the conference, so I'm sorry if you've already mentioned this. But I'd like to come back to the provinces that were disproportionately affected, as you said, by this. Could you please specify which provinces those are and why they were hit disproportionately hard? Some provinces have already spoken about this to the media, so I won't necessarily identify them, but I can say that some provinces were not affected, some very little, less than 10%, and one province in particular, over 50%. This is because the deliveries were prepared to be sent out from Europe for the vast majority of them. In some cases, Pfizer was able to work to reallocate the vaccines from different manufacturing plants. We received 82% of what we anticipated. Whereas in the case of Pfizer, we have a little less control over deliveries. Our commitment to provinces rebalance the upcoming deliveries to offset the losses that some provinces experienced. Thank you. Follow-up question? Yes. Major General Fortin was talking about certain figures, 10% and 50%. And I would like to specify in the period of April to June, you mentioned that 23 million people could be vaccinated. Taking into consideration all of the acquired vaccines. What exactly is taken into consideration when you move into that third quarter? How many agreements does that take into consideration?
Well, peut-être que mon collègue, Dr.
Perhaps my colleague, Dr. New, can add to this. But here's what I can tell you. In the first scheme, or the first projection, these are vaccines that have already been approved. In the other, we take into account increasing vaccines that have not yet been approved. I cannot speak to you about the dates when Health Canada will be in a position to approve more vaccines. And that, of course, has an impact on the third and fourth quarters. For a large quantity of these vaccines, Canada does have the intention of purchasing them. And if we're able to do so, this would have an impact on the figures we've shared with you. Dr. New, I would like to add several more precisions. We're talking about figures in alignment with the total of 6 million doses from both Pfizer and Moderna. And this takes the vaccines take 2 doses per person, and that would mean we could vaccinate 3 million Canadians. We, by the end of June, can expect to vaccinate 10 million more Canadians, and in the following quarter, we will be able to vaccinate 20 million Canadians, or 10 million Canadians in addition to that. So taking into account the 2 doses per Canadian, those are the numbers that we have. Thank you. Thank you, Dr. New. Next question.
See, our next question, Jamie Pashagumskum, APTN. Your line is open. À vous la parole.
Hi, thank you. This question is for Dr. Wong. Now, Moderna vaccinations have been going out across Indigenous communities, like you said. Now, these are initial doses, and I know that the next Moderna shipment is in February. So can these communities be expecting their second doses with this first shipment in February?
Yes, thank you so much, for your question. Indeed, there's no disruption of shipment of Moderna vaccine to Canada every 3 weeks. It's coming like clockwork. And we expect, all of, those Moderna vaccine that's been targeted for Northern Indigenous communities, they continue to come every 3 weeks. And with that, I'm going to turn over to Major General Fortin to have additional comments.
Yes, I think Dr. Wong explained it very well. So like clockwork, every 3 weeks, numbers will grow. We have multiple discussions at various levels, some that I personally am take part in to ensure that the interests of many are represented. Remember that one important variable that we're trying to factor in is to, given the distances, given access to some of the communities, provinces, territories, Indigenous Service Canada, and various stakeholders, ensure that we have the most efficient way to distribute, which includes not just vaccines to a location, but also the workforce, the enabling equipment with in terms of freezers and et cetera, to ensure that we can go into certain communities less frequently. If we can avoid going multiple times to vaccinate people in a location, the better. So that poses less risk of transmission of COVID transmission. So that's also part of the different immunization plans with the provinces and territories.
Thank you, Major General Fortin. Jamie, follow up.
Yes, hi. This question is concerning the delays in the Pfizer. Now, like we said, the northern remote communities have been getting to Moderna. Now, I'm wondering if the Pfizer delays are going to be affecting the southern Indigenous communities who are experiencing breakouts in their communities, as we speak. Now, will this also affect the immunization of urban Indigenous? Because I know right now, it's ongoing in Montreal with the homeless population, and there'll be some Indigenous people there. But the disproportionately impacted people in urban settings, including Indigenous people, will this affect them? And when will we see a rollout of vaccinations for them?
So delay in shipment affects everyone. And I cannot speak to provincial immunization plans. They will reprioritize as required the doses that they have available and the few that they receive the week after next, and factor that into their overall vaccination plan. That's unfortunately the best answer I can give you at this time.
Thank you, Major General Fortin. We'll move.
It's Dr. New. Dr. New, I can also add, obviously, as Major General Fortin has indicated, it's really up to the provinces to have to sort of recalibrate and sort of adjust to the sort of change in sort of expected shipments. And one thing I can say is that there are active discussions. I can't speak for individual provinces and territories, but I know that they're really looking at, in terms of the limited number of doses that they will be receiving of the Pfizer product, that they will be moving forward to give that, quote, second dose to people who have already received the first dose with obviously the recommended interval. So that's kind of the thinking now based on weeks. Thank you.
This is Dr. Wong. Just to echo what Dr. New just said and Major Fortin just said, one of the really critical component, that provinces, are doing is they are sitting down, with the partners and say, here, there is a temporary delivery challenge of Pfizer vaccine, but, we have, the Moderna vaccine coming into Canada like clockwork every 3 weeks. Let's actually plan together for the next few weeks, until the supply of Pfizer vaccine is ramping up, again. This is, really important. We are in the same boat together. Thanks.
Thank you, Doctor. We'll move to the next question. Operator.
Thank you. Merci. La prochaine question, Catherine.
Question from Catherine Lévesque from La Presse Canadienne. Hello, my question is to Major General Fortin. It's been 3 times in the past week that you have announced delays from Pfizer. We know that next week we will not have any new deliveries, and the week after, many fewer doses delivered than anticipated. Is there any way that Pfizer can change this delivery plan? Well, first of all, I'd like to specify that all 3 of us here today are representing the government, both my colleagues and myself. I can tell you that Pfizer has let us know that the setback in distribution are proportionate and are caused by setbacks in their manufacturing plant in Europe. We are not the only country not to receive any further doses next week. The impact in other countries is most likely very similar to the situation in our country, and we are always in close communication with Pfizer. I can tell you that we've already communicated several times already today. We are expecting, with a high level of certainty, 79,000 doses to be delivered in the first week of February. But I'm not able to give you detailed information about progress in their manufacturing plant, which is in Belgium. There is little we can do to change the impact on us in the short term. Thank you.
Oui, donc en suivi, autrement dit, à votre avis, est-ce que une...
As a follow-up, in your opinion, would it be useful for the Prime Minister to intervene at this stage? Why is it your responsibility, Major General Fortin, to keep us apprised of this series of bad news regarding the vaccine distribution this week? Well, I can't speculate on what the advantages or disadvantages would be of the Prime Minister or a minister intervening. But I can tell you that I am responsible for logistics and distribution of vaccines. And what I am trying to determine is what projections we can expect for the coming weeks. When it comes to projections for future quarters, those projections fall under the purview of Minister Anand, Minister of Procurement. And so I'm not the best one to answer certain questions, but I can talk to you about the short term. Sound quality for Dr. New does not allow for interpretation at this time. Service will resume as soon as possible.
Moins de vaccins. C'est à nous d'analyser c'est quoi les données probantes, c'est quoi peut-être les considérations pour nos homologues, les provinces et territoires à considérer pour vacciner leur propre population. C'est la réalité et c'est quelque chose à court terme et on entend toujours peut-être meilleures nouvelles dans les semaines, les prochaines semaines.
Merci, docteur.
Thank you, Doctor.
Mia Rabson, the Canadian Press. Votre ligne est ouverte. Please go ahead.
Hi. The European Medicines Agency seems to be saying that Pfizer is reducing their doses because they're now saying they can extract 6 doses per vial instead of 5. And I'm wondering if this is something that's going to be happening in Canada too, that they will be reducing the number of vials we get because they're saying we can now get 6 instead of 5 doses.
It's Dr. New. Should I start, or Danny, do you want to start in terms of Okay, maybe I'll start to your question, Mia. What we've already seen, and we've actually given practical advice sort of the provinces and territories, that Pfizer has indicated that if you draw out individual doses, obviously according to the proper instructions, that it is possible to get sort of consistently, quote, that 6th dose. So I think we've given a sort of the go ahead at a practical level for individuals at the clinical level in the clinics that they could look at and should feel comfortable if they can extract that 6th dose. It's not in the sort of the official product monograph at this point. I think Health Canada and the regulatory colleagues are looking at that, but I think that's how we're moving forward at a very operational level in terms of vaccination clinics and vaccination programs. I don't think, but I'll leave it to Major General Fortin, that it doesn't affect in terms of the number of, quote, vials we anticipate receiving from Pfizer BioNTech moving forward. Over to you, Danny.
Yeah, thank you. The Pfizer product is packaged in a certain way with a certain number of vials per package, and the product monograph is that you get 5 doses out of those vials, and if a series of factors considered, one can get more than 5, get 6 doses. I think the guidance so far has been, yes, absolutely, execute. So that's the numbers per vial.
Okay, and for my follow-up question, I'm curious when the provinces are going to be getting an update, or when you're publicly going to be telling us which provinces are going to get really hit and how many doses they're going to get this week, next week, the week after, because that information has been removed. But also why you are including, going back to an earlier question, doses of vaccine in your chart of how many people could get vaccinated this spring, using vaccines that are not even in third phase 3 trials yet. I mean, Sanofi has said that they won't even likely be ready until the fall. And so I'm just wondering if you can give us more specifics on how many doses from which companies you're including in that 23 million figure for the spring.
It's Dr. New, and maybe I'll start off, and pass it over as well to Major General Danny Fortin. I think if you look at the graphic we've given to the media, I think the most important line really is the first line, because this is sort of what we have in hand right now. We've got 2 approved vaccines, and if everything goes according to schedule in terms of the number of doses we anticipate receiving, then we should be able to offer all Canadians vaccination by the end of September. If you look at the numbers there, they're cumulative, and so we've spoken about the 6 million doses of both combined of Pfizer and Moderna by the end of March. That's enough for 3 million Canadians. We anticipate getting 20 million doses combined of the two approved vaccines by the end of June. So that'll be another 10 million Canadians. So that'll be a total of 13 million Canadians. And then by the end of September, getting another 40 million doses. That's another 20 million Canadians. Yeah, add that to the figure, you get your 36 million Canadians. And even then, we know that it's only approved for obviously individuals over a certain age. And so, and plus the fact that not everyone might take up the offer to get vaccinated. So I think it's more than enough to be able to offer all Canadians vaccination by the end of September. The other line, to be honest, I think is as Major General Fortin has indicated, is for planning purposes. At the present time, the Government of Canada has advanced purchase agreements for a total of 7 manufacturers. And you're right, some of them are in the sort of early stages in terms of their clinical trials. The data hasn't really been come out and been analyzed yet. Many of them, several of them, have not even put a submission forward to Health Canada in terms of the regulatory process. But I think it's just good to know and to show Canadians that the Government of Canada has these advanced purchase agreements, and should circumstances change and something were to happen in terms of the two approved vaccines for which we sort of fully expect at this point to get our number of doses, to the end of the third trimester, that those other vaccines might become part of our suite or portfolio of vaccines.
Let me just add very briefly two important elements. First, in terms of allocation tables on our portal, on the Government of Canada webpage, under vaccines, we did remove the Pfizer allocation tables for obvious reasons. They have changed, and they're changing, and we're not ready to share any visibility other than the obvious no data next week and what we just learned, and we're crunching the numbers as to what that means for first week of February. So as soon as this is compiled, that data will be made available to the public. More importantly, we're now working with our counterparts in provinces to determine how this allocation, how this will translate into, for them over time. The other piece I want to just highlight is, you might recall I explained several weeks ago now the different things that we were doing here at the agency to prepare ourselves in terms of contingencies, looking at gaps, tabletop exercise, a rehearsal of concept with a number of stakeholders, participants from across the nation, to really look at the gaps, the risk, identify possible mitigations, and way to perhaps anticipate as much as possible those things that might come to the fore. It would be, you would expect me to think of the different contingencies. And a positive contingency is millions of vaccines that become approved sometime in the next months and become available and produce in such quantities that we can have them in the spring, we can have them in the summer, and what does that look like over time? So we need to start preparing for that. So what you're seeing is the high water mark. What you're seeing with that second line is a potential millions of vaccines over time, and you have an aggregate just to understand the scope, magnitude of what could potentially be distributed across the country. So they're very much planning figures, back to Dr. New's comment, planning figures to help us visualize the size and scope of the situation that we're working with.
Thank you, Major General Fortin and Dr. New. We have time for one more question, so I'll put it over to you.
Thank you. Merci. Our next question, Dylan Robertson, Winnipeg Free Press. Voting est ouvert. Please go ahead.
Hi there. A question for Major General Fortin. It kind of follows up on the last one. Provinces like Manitoba are reporting that they don't have enough doses to immunize everybody. The projection right now is 70% of adults by December 31st, not the 100% by the end of September. So I'm wondering what accounts for these differences in the forecast, and are you not sharing the same granularity of data with the provinces?
So we are sharing all the planning data with the provinces, I think, through multiple tables. I'll ask Dr. New to add his thoughts on this, because I think that's extremely important for people to understand the various tables, the various input that we have, the opportunities to share, to build a shared understanding of the situation, expectations in terms of percentage of Canadians that might want to get the vaccine, and what that translates into in terms of our activities.
Yeah, it's Dr. New here, and what I will add is that we are always having active discussions with our counterparts, the chief medical officers of the country, and certainly the issue of the allocation on a per capita basis. Certainly recognizing that there are maybe some unknown factors in terms of the stability of sort of the deliveries, and obviously we're experiencing that right now. But certainly it hasn't come to my attention that there is a sort of a different sort of conclusion in terms of how many Canadians, or to what percentage of the population in any given province would not somehow, as you've indicated, would not be able to be offered vaccination for all of their residents. Certainly, moving forward at the present time, that we have that shared understanding that all Canadians in all the provinces and territories would be able to be offered vaccination by the end of September. So maybe we'll have to, take it offline in terms of your getting different figures and so on. But certainly that's not the understanding of the figures that we've been working with.
Okay, and for my follow-up, please ignore the background sound here. Dr. Wong, we're aware of some Indigenous leaders wanting to extend the vaccine period within the 6-week guideline, even when their provinces are sticking with the manufacturer guideline. I'm just wondering if ISC supports that, and if you provide any kind of epidemiological support in governments, in nations making those sorts of decisions.
Dylan, for some reason, there's interference while you were actually trying to ask the question. Can you actually maybe reposition your mic a little bit so that we could hear you? Because there was a sharp interference during when you were trying to actually ask the question. Thanks.
Hi, Dylan. If you can maybe turn down the volume on your phone, there's a feedback coming in.
Sure. It's a fire alarm drill, so I apologize. Bad timing. Dr. Wong, we're aware of some Indigenous leaders wanting to extend the vaccine period within the 6-week guideline, even if the provinces are sticking with the manufacturer guideline. And I'm wondering if ISC supports that, and if you're providing any epidemiological support to nations in making those decisions.
Yeah, thank you so much, for the question. Just last week, the National Advisory Committee on Immunization has updated its guidelines, on the dosing interval between the first dose and the second dose, evaluating all available evidence, including from all available clinical trials data. And the conclusion that they made public, was that, for both vaccines, currently, it is important to be following, the 3 to 4 weeks, dosing intervals, as recommended by the manufacturers. However, when analyzing the data, because some of the participants in those trials actually, did receive their vaccine, at day 42 or 6 week out from the first dose. And after analyzing those data, they came to the conclusion that it's permissible, in circumstances when there's a shortage of vaccine, to stretch that dosing interval, from 3 to 4 weeks, depends on the vaccine, to up to 42 days out or 6 weeks out. But one thing that's important, though, is that they highlight there is currently not yet any evidence beyond 6 weeks out. I think that's very important, when, different jurisdictions and different partners, when they actually consider, how far to stretch, that dosing interval. And of course, the 6 weeks, is in line with WHO as well. With that, I'm going to turn over, to Dr. New for additional comments. Thanks.
Hi, it's Howard New. I don't have much more to add to Dr. Wong. I think the National Advisory Committee of Immunization has said that under exceptional circumstances, so Dr. Wong alluded to the sort of maybe constraints in the vaccine supply. But I would also say that it also depends on the epidemiological situation. So certainly if there's a very high, community transmission, high rates and so on, that's something that needs to be taken account probably at the local level in terms of what type of vaccine schedule may wish to be used. However, I would add, and I think it's in the media right now, is that it's important to also learn from the experience around the world. And I think all of us, including us here in Canada, are looking very carefully. And we're having, I think we're going to have further discussions with our colleagues, our public health authorities in Israel, because Israel has been very good in terms of their vaccine rollout. And there's some preliminary data that's been published or at least put out in the media, but we certainly want to have as you say, take a deeper dive and have further discussions in terms of what they're finding in terms of their real life experience, in terms of what the delay in between the first and second dose has had on the sort of the vaccine effectiveness in their population. So I think that'll be informative for us here in Canada as we move forward. Thank you.
Thank you, Dr. New. That will be all for today's technical briefing. Any additional questions can be directed to the Public Health Agency of Canada Media Relations at 613-957-2983 or by email at hc.media.sc@canada.ca. La séance est maintenant terminée. On vous remercie de votre participation. Si vous avez d'autres questions.
This ends today's press.